In 2005, the Department of Human Services, under the leadership at that time of Dr. Carol Adams, convened an African American Summit on Prevention. One of those priorities or concerns was that there was not a collective voice at the table when it came to the macro level design, implementation, evaluation of prevention systems, policies, and programs. Over a year-long intentional planning process, the committee decided to launch the Illinois African American Coalition for Prevention.
Central to the Illinois African American Coalition for Prevention mission is our commitment to reducing risk factors and increasing protective factors in our communities. Our efforts tend to be focused in three areas. One, creating safe communities through evidence-based violence prevention programs. Two, improving health outcomes for families and children. And three, providing our youth with the skills they need to overcome roadblocks and actualize their potential.
I didn't know anything about the Illinois African American Coalition for Prevention, and I met the executive director, Malik Nevels. I think many times people feel, like I have this problem that's happening in my community, but I don't know how to tackle it myself, and I don't know where to go for resources. But here was an organization that had resources, they had access to legislators, which we know is a lot of times is very important to getting our causes seen and heard. They were able to bring together different groups to look at issues and potentially impact them in a very positive way.
We partnered with the Illinois African American Coalition for Prevention in 2010 for the Neighborhood Recovery Initiative, now called the Community Violence Prevention Program. And the Illinois African American Coalition for Prevention was very instrumental in providing Children's Home and Aid, as well as the other communities and agencies involved in this initiative, with technical assistance, with resource sharing, and just being that very strong partner, all in efforts to, again, address some of this community violence.
The four pillars of our work is to first increase public awareness and consciousness about social and health disparities negatively impacting African American communities. The second is we identify and promote what we believe to be culturally relevant practices, policies, and programs that strengthen prevention in African American communities. Our third pillar is to build the capacity of other organizations that provide prevention services to our communities. And last but not least, and what we consider to be just as important, is increasing financial and other resources for organizations that provide prevention services to our community by educating legislators, policymakers, and just the general public about the cost effectiveness of prevention.
And we've actually also been the recipient from the Illinois African American Coalition for Prevention. We actually have received information from a partnership with Northwestern University to receive grant funding for community-based participatory research. But had it not been for the Illinois African American Coalition for Prevention, we would not have known that information. And from that, we've received a cycle of grant fundings through that partnership.
I strongly believe that partnering is, if not the #1 way to advance in the communities, it's at the top, because Illinois African American Coalition for Prevention actually has a lot of information. They're willing to educate, but at the same time, they're very open to learning new things. So for me, the biggest thing was the compassion and actually seeing them eager to get their hands dirty with us and not just be in the office.
We have a quarterly meeting for our coalition members, and I would greatly encourage anyone to attend one of our quarterly meetings. You will find that we are an organization of substance. This is an organization of people, and so it's a partnership. It's about membership. It's about fellowship and getting to know the other players, both locally and nationally. It's extremely affordable. For $50,
to be a member of this organization and to see all of the benefits that come from it, to be privy to our resources and materials, and to be part of this organization in such an accessible way is truly a positive benefit for anyone who wants to be part of progressive change in the 21st century. This organization has a track record. We did not start yesterday, but we've started over 5 years ago. And in that time, we have managed dozens of grants very successfully, sometimes in second round. So we have extremely strong leadership. We have a great executive director who is a lawyer by training, but has also worked in government and in other nonprofit organizations. We have a strong board of directors who come from a variety of fields, from business to law to healthcare. And so you can feel assured that we're going to hold ourselves accountable and the organization accountable to being fiscally responsible and to remaining true to its mission. And thirdly, you should know that this demographic and these concerns are central to where our country is and where it's headed, and not only in terms of how we think about healthcare, but how we think about a variety of economic and national policy problems and challenges, about solving the problems from the beginning and not waiting until it's too late.
For more information about the Illinois African American Coalition for Prevention, please visit our website at ilaacp.org.